A new study from Columbia University researchers reveals that air pollution can weaken bones. Bone degeneration or osteoporosis is a serious condition, especially among the elderly, with an estimated 2 million cases in the U.S. each year, costing over $2 billion annually. Air pollution has also been linked to many other health problems, including cancer, respiratory illness, birth defects, blood and neurological disorders. To discuss this, we are joined now by one of the study's researchers, Dr. Diddier Prada with the National Cancer Institute. All right, doctor, can you explain for viewers how this study was conducted and the link you discovered between bone degeneration and air pollution?
Hi, thank you for the invitation. I'm very excited with the results. Well, this study started as an exploratory analysis. We ran some analysis in a cohort from Massachusetts, the backbone cohort, and we explored if the people who lives in the area of large Boston had some changes in calcium-related hormones and also with the bone mineral density. And we had some data of this population, 8 years of follow-up, and we found the first results that were very exciting, in which we found that with the time during the follow-up, the people who live in higher areas of exposure, higher levels of black carbon exposure, they showed larger or bigger decrease in bone mineral density during these 8 years of follow-up. We also found some interesting results about a calcium-related hormone, the PTH, or the parathyroid hormone, that is the first time that has been reported some association with air pollution and this hormone. So for us, these results was very nice. However, we wanted to link with a real clinical outcome, so we started to analyze data from Medicare in the elderly, and we explored the association with hospitalization for bone fractures, and we analyzed a large number of cases, more than 750,000 cases of fractures during 8 years, and we found the association that the people who live in areas with higher levels of exposure to PM2.5, to air pollution, showed higher rates of hospitalizations for bone fractures. So for us, it was a great finding, a novel finding. Well, it's a novel link between air pollution and disease in humans.
A stunning aspect of your study was how you found a disproportionate impact of this link on poor communities. Can you elaborate on how environmental racism factors in here?
Yeah, one of the sub-analyses we ran in this study was what was the impact in different populations, and we explored the socioeconomic factors. And well, we observed that the low-income population shows stronger impact. So for us, it was a very also novel and interesting finding that if you are poor, your bones are also affected for air pollution. So we are very interested in this population because, well, it's not only the income, it's also your health that has been affected for many factors.
The World Health Organization said that just this year, 1.7 million children will die due to air pollution. What steps can be taken to reduce these risks?
Well, we know that the fight against air pollution is complicated, and we have been doing this for years. We previously know that it affects cardiovascular system, lungs, and other systems, and now we know that it's affecting also bones. So we have to try to improve our air using better policies for a cleaner air, and try to motivate our politicians to work with us. It's not only about fossil fuels, it's about cost, because if you reduce air pollution, you're going to reduce the impact on human health and to reduce cost in health systems. So I think it's important to keep cleaning our air from air pollution.
In about the minute we have left, can you break down some recommendations you might make to a government following this study's publication, or is more research needed?
Yeah, well, we have to keep running research like this, trying to find more impact on. I'm sure that if we explore many other diseases, we're going to find in the next years more association between air pollution and human disease. So we have to continue our work, our effort in this line, try to motivate our politicians to keep working on more policies about clean environments. That's all.
All right, Dr. Diddier Prada of the Laboratory of Carcinogenesis with the National Cancer Institute. Thanks so much.
Thank you so much.